Good morning and welcome to today's Federal Retiree and Medicare presentation. We are thrilled to see this high level of cross-jurisdictional representation to include Fong Tong, who works with the Office of Program Operations and Local Engagement at the Centers for Medicare and Medicaid Services. Before we begin, I want to introduce myself and also my dynamic team who's joining us today. My name is Michelle Thomas, Program Coordinator of the Arlington County's VICAP program. Today, myself and most team members on the VICAP team are joining us to spearhead today's virtual presentation. And I want to thank John, Patty, and Don for the collaboration in ensuring we have a seamless virtual event. Together, our office provides free, unbiased, confidential counseling for Arlington County's Medicare beneficiaries, their caregivers, neighbors, and care partners. I also have a few housekeeping items to share and want to alert you that due to COVID-19, Arlington County VICAP is providing assistance from a distance, which entails working remotely. Please remain connected with us by calling 703-228-1725 or by sending us an email at medicarehelp@arlingtonva.us. Since everyone is in listen-only mode, our team invites you to submit your questions through the Q&A function, and we will respond to you in the order in which your question was received. We will do our best to answer everyone's questions, but if we cannot, we request that you send us an email to medicarehelp@arlingtonva.us, and we will follow up with you just as soon as we possibly can. Lastly, and before I turn it over to Don, one of our fantastic and phenomenal VICAP volunteers, I want to share that Arlington's Area Agency on Aging, in collaboration with the Commission on Aging, is spearheading our annual Community Engagement Forum that's going to be held on March 15th from 9:30 a.m. to 12:30 p.m. This is a time when Arlington residents come to the table and talk about issues that matter most to Arlingtonians. I also want to share that before we dive in to Don's wonderful presentation, I have some notes here from Fong, our lead at CMS, to share with you today. As it relates to Medicare and COVID-19 vaccines, Fong wants everyone to know that CMS added the COVID-19 vaccine and its administration to the list of preventative vaccines covered under Medicare Part B without coinsurance or deductibles. People with Medicare pay nothing for COVID-19 vaccines, and their copayment, coinsurance, and deductibles are waived. Under the umbrella of Medicaid, Fong wants you to know that Medicaid and CHIP must provide vaccine administration with no cost sharing for most beneficiaries during the public health emergency. Post the public health emergency, depending on the population, states may have to evaluate cost-sharing policies and may have to submit state plan amendments if updates are needed. And lastly, from Fong, and thank you so much, Fong, for sharing this dynamic information. As it relates to the uninsured, Health Resources and Services Administration, also known as HRSA, program to reimburse vaccine administration for the uninsured and underinsured individuals. So thank you so much, Fong, again for joining us today. We are excited to have you. I also want to thank the Area Agency on Aging leadership for joining us today, and I want to thank our partners from across the state of Virginia, but also outside of the state of Virginia for joining us today as well. Now we are going to transition over to our presentation, and thank you so much again for joining us today. We look forward to talking with you and connecting with you outside of the presentation. Don, take it away.
Good morning, everybody, and welcome to our webinar presentation entitled FEHB, Original Medicare, Medicare Advantage, What's a Person to Do? A little bit of background about myself. I actually am a retired federal employee, having worked at the Department of Health and Human Services for almost 30 years. So I've gone through a lot of what we're going to talk about today from my personal perspective, as well as a Medicare counselor with the VICAP team. So I'm going to skip through the first couple of slides because Michelle has already dealt with those. And to start with the objectives for the session. So what I hope to do during this session is discuss Medicare coverage, explain Medicare eligibility requirements, enrollment periods and costs, discuss options for federal employees and retirees, and discuss a little how Medicare and FEHB work together. Okay, I think that we all know that healthcare and healthcare expenses are an important part of retirement. You've likely heard that a married couple at age 65 can expect to spend $360,000 over the next 25 years on healthcare, including premiums and out-of-pocket expenses. And that $360,000 does not include long-term care, which is completely separate from Medicare and FEHB. So the question posed originally in the title was, should you sign up for Medicare? And there's a very simple answer to that question. It's yes. But for federal employees and retirees, it's not quite that simple. It's a little more complicated. So with that background, let's move on and talk about Medicare. Now, I'm going to provide an overview of Medicare. If you really would like a deeper dive into Medicare and its various parts and nuances, I would encourage you to sign up for our webinar on Medicare 101, or the Introduction to Medicare, that's offered from time to time. All right. So what is Medicare? Medicare is actually the nation's largest health insurance program. It currently covers just over 31 million lives and expends about $800 billion in benefit payments. The program is administered by the Centers for Medicare and Medicaid Services as part of the Department of Health and Human Services. It's health insurance for basically three groups of people: individuals who are 65 and older, those individuals under 65 with certain disabilities, including ALS and Lou Gehrig's disease, persons any age who have end-stage renal disease, which is kidney failure requiring dialysis or a transplant. It's important to remember when considering your options for Medicare that Medicare is for individuals. There is no self plus one or family options in Medicare. It's only for the individual. Medicare has four parts. Part A, hospital insurance. Part B, medical insurance. Together, these two make up what's called Original Medicare. And that's the program that was originated in 1965. And it's sort of modeled after the health insurance industry at the time. So you have this separate hospital versus separate medical. Later came Medicare Part C, which is the Medicare Advantage plans, which includes your HMOs and PPOs. And they provide benefits that are included in Part A and B, and usually Part D. Now, Part D is the latest addition to the Medicare bundle, and it includes the prescription drug coverage. So hospital insurance, coverage basics. So Medicare Part A covers inpatient hospital care, skilled nursing care, home health care, hospice care, and finally it covers blood, but I won't talk about that a lot. Part A is premium free for most people. That is those who pay their payroll taxes for 40 quarters or 10 years. For those who do not meet that 10-year work test, the premium is quite steep. It's about $471 per month in 2021. That would not be a great deal for a federal employee or a retiree with an FEHB plan. and you would not likely enroll in Part A if you were subject to such a premium. So hospital care includes private room, meals, general nursing, and other hospital services and supplies. The coverage does not include private duty nursing and most physician services that you receive while you're in the hospital. Paying for inpatient hospital stays, again, if you have premium-free Part A, when you go to the hospital for each benefit period, for days 1 to 60, you would only pay a $1,484 deductible. If you were in for a longer period of time, if you continued in the hospital for 61 to 90 days, you would have to pay out of pocket $371 per day. After the 90 days, you would move into what's called your 60-day lifetime reserve days. Okay, these would cover you for period 91 through 150, and then you would pay $742 a day. After the 150 days are gone and used up, you would pay all costs. I recently saw a local hospital bill for room and board. It was about $1,600 a day, so that would be out of pocket if you were in for that long. Part A also covers skilled nursing care. Skilled nursing care is a non-custodial, not long-term care. It covers semi-private room, skilled nursing facilities, and rehab services, and other services and supplies that are needed. Okay, in order to qualify for skilled nursing care after a hospital stay, you must have been in the hospital as an inpatient for 3 consecutive days or longer. Okay, I like to think of it as a 3-night rule rather than a 3-day rule because it doesn't count the day that you leave the hospital. So if you're not in for more than 3 days, or at least 3 days, you're not eligible for SNF care under Part A. Now, many people get confused, and I highlighted the word inpatient because often you'll be in the hospital and they'll put you in a room for observation. If you're in a room for observation, even if you're in for several days, you're not considered an inpatient and not eligible for SNF care. So it's important to know whether you've been admitted or not. Paying for skilled nursing care. For each benefit period, you pay nothing for the first 20 days of care. After the first 20 days, 21 through 100 days, you would pay $181.50 a day. And after 100 days, you would pay all costs. Again, you qualify for skilled nursing care every time you have a new benefit period, meaning that if you're in the hospital in January for a knee replacement and you've been in for at least 3 days, when you're released, you could go into a skilled nursing facility for rehab. If you go back into the hospital in September for another knee replacement, you would have another benefit period, and you would again be eligible for a new round of skilled nursing care if you met the 3-day rule. Part A covers home health care. Home health care covers medically needy part-time and intermittent skills nursing care, and or physical therapy, speech and language pathology services, services for people who with continuing need for occupational therapy. Home health services may include medical social services, part-time intermittent home health aides services, durable medical equipment, medical supplies for use at home, but you must be homebound in order to qualify for home health care, meaning that it must be very difficult for you to leave the home. If you tell the providers that you can drive to your medical appointments, then you're not homebound and you wouldn't be eligible for home health care. Paying for home health care, Part A fully covers home care. In original Medicare, you not pay for any home care services. If you have durable medical equipment, you would pay 20% co-insurance. If your home health care is not covered by Part A for whatever reason, it's possible that it would be covered by Part B. Hospice care is also provided under Part A. which is a special way of caring for people who are terminally ill and their families. Hospice care is meant to help you make the most of the last months of your life by giving you comfort and relief from pain. It involves a team that addresses your medical, physical, and social, emotional, and spiritual needs. The goal of hospice is to care for you and your family, not to cure your illness. The hospice, as with most providers, the hospice provider has to be approved by Medicare. You pay nothing out of pocket for hospice care. Let's move on to Part B. Part B is medical insurance, and it covers physician services, durable medical equipment, home health care, x-rays, lab services, outpatient hospital services, mental health services, and many, many home preventative health care services. Part A, Part B, doctor services or physician services, medically necessary, you pay 20% of the approved amount if the doctor accepts assignment, which is something I'll address later. And you pay a Part D deductible. You pay nothing for most preventative services if the doctor accepts assignment. For outpatient services, for approved services, you will pay the doctor the 20% copay, coinsurance, and you also pay the hospital a copayment for each service, and the Part B deductible will apply. Part B covers over 24 preventative services, including vaccine shots, such as what we just heard, the COVID-19 vaccine, your flu shots, your Hep B shots, and pneumonia shots. But it does not cover shingle shots. So if you go for a shingle shot, don't be surprised if you receive a bill for it if you're doing it under Part B. It also covers many standard cancer screenings for both males and females. And these are primarily free to the individual participating in Part B. Things that are not covered by original Medicare: long-term care, routine dental care and dentures, vision care, including glasses and contacts, cosmetic surgery, acupuncture, hearing aids, and exams for hearing aids fittings. And also, not on the slide, is drugs. Medicare, original Medicare does not cover your prescription drugs. And that's something that we will look to for a Part D plan later on. So those are the two parts of original Medicare. So the question is, when can you enroll in original Medicare? There are several opportunities to enroll. If you're receiving Social Security benefits when you turn 65, you will be automatically enrolled. If you're not receiving benefits at age 65, you will have what's called your initial enrollment period, your IEP. If you're continuing to work past 65 and have health insurance through your employer, such as your FEHB, you can delay enrollment until you leave work, and you will have a special enrollment period, or SEP. And if you miss your IEP and SEP, there's also an annual GEP, or general enrollment period. If you wait for your general enrollment period, you may be subject to penalties on your premiums. Here's just another chart which kind of outlines those enrollment periods, the IEP, the GEP, and the SEP, and when they occur. I'm going to go into a little bit more detail about these. So, automatic enrollment. So you're receiving your Social Security benefits, or your railroad retirement benefits in that case. 3 months before your 65th birthday, you will receive a Welcome to Medicare package. And in that package will be your red, white, and blue Medicare card. And on this slide, you can see the little Medicare card there. It'll have your name, your Medicare number, which is not your Social Security number anymore. It used to be, but they've changed that for confidentiality reasons. And then it'll have whether you're enrolled in Part A and Part B and the effective dates and coverage. Okay, so you'll receive this package. If, when you receive this package, you don't want to participate in Part B, All right. You can return the card and follow the directions on the back of the card, and they'll take you out of Part B. If you kept the card, you will be enrolled in Part B, and you will pay the premium starting with the month that your policy becomes effective. If you're not automatically enrolled in Medicare because you're still working and not on Social Security, you will have what's called the initial enrollment period. You can sign up for Medicare Part A or Part B during the 7-month period that begins 3 months before the month you turn 65. It includes the month you turn 65 and ends 3 months after you turn 65. You sign up, not surprisingly, someplace else for Medicare. You sign up with the Social Security Administration, not CMS, the Department of Health and Human Services. You sign up at the website and fill out the form. This is a screenshot of the SSA.gov website. If you look at the screenshot, you'll see that in the lower right-hand corner, there's a place for Medicare enrollment. So you click on that, and it'll take you to the enrollment page. And then you scroll down, and there's an application button. You push that, and it will take you to the online application, which is pretty simple and straightforward for a government document, and it's very quick and easy to fill out. So applying online is probably the easiest and most effective way of applying for Medicare during your IEP. You can also call Social Security and apply on the phone, but there's often a long wait time for calls. And during the COVID, Social Security offices are closed, so you cannot enroll in person, which is something you could have done pre-COVID. Okay. If you're still working and you have FEHB, there's really no reason to sign up for Part B at that time. Okay, so again, if you're working or your spouse is working and you have FEHB coverage, you may want to delay signing up for Part B, okay? Because there's little benefit for Part B while you're working, because Part B is secondary payer, meaning that your FEHB plan pays primary, and Medicare will only cover the unpaid copays and coinsurance that your FEHB plan didn't pay, which are already quite low in your FEHB plans. So it's highly likely to make the premium worth it, but I'll talk about that more a little bit later. Note that if you're military or retired military with TRICARE for life, you must sign up for Parts A and B when you're first eligible. Also, I just want to say that if you're a non-federal employee or retiree listening, it's really important that you check in with your HR department. Some organizations, government, state and local governments and firms require you to sign up for A and B when you're first eligible. For example, Fairfax County retirees must sign up for A and B when they retire and are first eligible, while Arlington County employees have the option to sign up for B when they retire. Okay, so when your employment ends or your spouse's employment ends, you have 8 months to sign up for Part B without penalty. You get a special enrollment period, and if you enroll in Part B, but if you enroll in Part B after the 8-month special enrollment period, you may have to pay a late enrollment period penalty, and you'll have to wait until the next general enrollment period to enroll. So enrolling during your special enrollment period, this 8-month period, you sign up on SSA.gov using the form CMS 40B, and you will also have to fill out form CMS L564, and then have your HR department fill out another section of it, which certifies that you were employed or your spouse was employed, and that you had health insurance during that up until that period. In this way, you can sign up for Part B and you will avoid any penalty. The last enrollment period is the general enrollment period. This is an annual period that's available for enrolling in Medicare, January 1 through March 31st each year, with coverage effective July 1 of that year. You may face a penalty for Part B if it's been 12 months or more since you were first eligible to enroll. So the penalty is 10% for each full 12-month period you were eligible but not enrolled. If you had FEHB coverage, there would be no penalty. If you do face a penalty, you pay that penalty for as long as you have Part B. Okay, so let's look at paying on Part B. Okay, Part B, the Part B premium is $148.50 per month, or higher depending upon your income. More on that later. Part B has a $203 per year deductible, meaning that before Part B will pay anything towards your outpatient or doctor's visits, you will pay the first $203. After you meet your deductible, you typically pay 20% of the Medicare approved amount for most doctor services, including doctor services while you're at inpatient hospital, outpatient therapy, and durable medical equipment. If your provider participates in Medicare but does not accept what's called assignment means that they accept the charges that Medicare allows, they can charge 115% of the Medicare approved amount. This is referred to as a limiting charge or an excess charge, and you would be responsible for that charge. For an example, if the providers billed a charge of $2,500 for some procedure, and let's call that the full retail price, and Medicare's assignment is $2,000, the most the provider can charge you is $2,000 times 115%, or $2,300. So Medicare now will come in and pay 80% of the $2,000, which it allows, or $1,600, and you'll wind up paying the $400 for the 20% that you would normally pay, plus the excess charge of $300. Remember that you pay nothing for preventative services that are offered by doctors and physicians that accept assignment. Okay, so as I mentioned in the last slide, the Part B premium is $148.50 or higher depending upon your income. The Social Security Administration determines your premium, which may include a surcharge based on your income tax return from 2 years prior. SSA uses a modified adjusted gross income, or MAGI. So it's not exactly the AGI that you would see on your tax form. So this current chart shows an overview of the Medicare premium and an income-related surcharge that you may face depending upon your income. So for example, if you're an individual filer, single person making $88,000 or less, you would pay the base premium of $148.50. But if you had income above $88,000 and up to $111,000, your premium would be $207.90. If you were above $111,000 and up to $138,000, it would be $297. If you were above $500,000, your premium would be $504.90, which happens to be the full actuarial value of the Medicare Part B program. It's important to realize that MAGI consists of wages and salary, interest and dividend income, capital gains income, pension income, rental income, 50 or 80%, 85% of your Social Security retirement benefits, and other income. This includes tax-exempt income and tax-free dividends that are included in MAGI. If this applies to your current Part B premium, you'll receive a letter from the Social Security Administration notifying you of this in November or early December. You can appeal this additional charge following receipt of this notification. It's also important to know that one-time bumps in your income can trigger this income-related subsidy or subcharge. For example, if you sold investments or withdrew a lump sum from your TSP to buy a luxury RV, or sold your house and have taxable gains on top of your retirement and other income, you may find yourself with a hefty Part B premium. Likely this will last only 1 year, but it can be a shock when you get that letter from the SSA 2 years after you sold those assets. As I mentioned, you can appeal this income-related assessment. Okay, if you have a change in circumstance, they list 8 very specific reasons that you can use to appeal. And you appeal by using a form SSA 44 request for redetermination, which is found on the SSA website. Since they determined the premium, we appeal to SSA for any relief. So the reasons include marriage, divorce, annulment, death of a spouse, work stoppage, work reduction, loss of income producing property, loss of pension income, and employer settlement payments. So having one lump sum payment, such as cashing in part of your TSP or selling some assets, is not a reason for appeal. The most likely reason for appeal for most federal retirees is work stoppage. Recall that they set this premium surcharge based on your income from 2 years prior. And when you retire, you're likely to see a significant drop in your income from 2 years prior. So it may be worth it if you're enrolling in Part B and you receive one of these letters about a surcharge to appeal. How do you pay for your Part B premium? It's easy. It's deducted automatically from your Social Security benefits or your federal retirement benefits. If you don't have enough money in those benefits to pay it, they'll send you a bill on a quarterly basis, and then you can send them a check or pay by credit card. Okay, so those 2 pieces are our original Medicare, okay, Part A and Part B. Now we're going to turn our attention to a newer part of Medicare, which has been around for quite a while, Medicare Advantage. The thing to know about Medicare Advantage, it's also known as Part C, is that you must be enrolled in Medicare's Part A and B to participate in the Medicare plan, Medicare Advantage plan. This is an alternative system for delivering the same services as original Medicare, but through private insurance plans called Medicare Advantage plans. The key points are outlined in the chart. Again, you have to be in A and B. It's run by private companies. It usually will cover not only A and B, but include Part D drug coverage. And it may, and usually does, include extra benefits and services. There are basically 2 types of Medicare Advantage plans. Your health maintenance organizations, think Kaiser Permanente, and provider organizations, such as the Blue Cross Blue Shield plan. Currently, there are 24 Advantage plans available in Arlington. If you want to have more details about these, you can look at the Medicare Plan Finder, medicare.gov/Medicare Compare. You can see the complete list of Part C plans available in our area. How do these work? Okay, so you pick a plan based on your service area and zip code. You remain in Medicare with all the same rights and protections. You still get all the Part A and Part B premiums. You still have to pay your premiums for Part B in addition to your MA plans, premiums and costs. It's likely to include prescription drug coverage, and it may include, and likely does include, additional benefits such as vision, dental, and hearing. Cost may be different and a little bit higher if you go out of network, and also benefits and cost sharing are different from original Medicare. Instead of paying a 20% coinsurance for Part B services, you may pay a flat copay of $25, $35, or $45 for each visit. Medicare Advantage recently Medicare Advantage plans have been able to offer a broader menu of supplemental benefits in addition to extra benefits to either all MA beneficiaries, or they can restrict these benefits to certain participants with chronic conditions. These are optional benefits, supplemental benefits, and they don't have to offer them. The only way to determine what supplemental benefits are being offered and the eligibility requirements and whether you would be eligible to receive them is to carefully read the plan documents. The other way to do it is to actually, if you belong to one of these plans, is to actually reach out to the plan and confirm your eligibility to participate in these. So when can you join or switch MA plans? During your initial enrollment period, again, that begins around your 65th birthday, you sign up for Part A and Part B, and then you can enroll in a Medicare Advantage plan. There's an annual Medicare open enrollment period, which runs from October 15th to December 7th, with coverage beginning January 1. During this open enrollment period, you can switch from original Medicare to a Medicare Advantage plan. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. Or you can switch from Medicare Advantage plan and go back to original Medicare. So there's a lot of things that you can do during this Medicare open enrollment period for Medicare Advantage. There's also several opportunities for a special enrollment period. If you move out of the plan service area, you would not be eligible to participate in that plan anymore, and you would have the opportunity to enroll in a new plan. If the plan leaves the Medicare program, you would certainly have the opportunity to enroll in another plan. So what do Medicare Advantage plans cost? So you must still pay the Part B premium, which is your $148.50 or higher. You may also pay a monthly premium to the plan, although many are zero extra plans. You pay deductibles, coinsurance, and co-payments, which differ from original Medicare, and they vary from plan to plan. Costs may be higher if you go out of network. Remember that Medicare Advantage plans are not Medigap plans. In fact, you cannot have Medicare Advantage plan and Medigap at the same time. Again, the requirements for enrolling in a Medicare Advantage plan is you must live in the plan service area, you must be in A and B, and more recently now, you can join a Medicare Advantage plan if you have end-stage renal disease. If you want to explore MA plans in great detail, you can do that at medicare.gov/plan compare. And then I would encourage you to look carefully at the plan documents. The last part of Medicare, the most recent part that was added, is the Medicare prescription drug coverage. It's the fourth leg of the Medicare stool. Okay, it's referred to as prescription drug coverage. It's offered by private insurance companies. The coverage varies, including the drugs covered, which is in the plan's formulary, which is a list of all the drugs that they cover. The co-payment amounts may differ by plan, the deductibles may differ by plan, and how they treat the gap in coverage may differ by plan. You're certainly encouraged, if you're looking at a Part D plan, to compare the plans prior to enrolling. Again, medicare.gov/plan-compare. And so Medicare Part D coverage, again, private companies approved by Medicare, available to everyone with Medicare. If you have A and or B, you're eligible for a Part D plan. Use the plan finder. Currently, there are 30 Part D plans in the Arlington area. And recall that your Medicare Advantage plans generally include this coverage. So what do Medicare drug plans cost? In 2021, the monthly premiums range from a low of $7.30 a month to a high of $85.50 a month. There's also a Part D surcharge based on your income. For higher income people, there is a higher Part D premium which you may need to be aware of. The base premium used to calculate a penalty for late enrollment is $33.60. The yearly deductible that plans can allow is up to $445. And then there's the co-payments and insurance. Again, Part D eligibility requirements, able to join, you must have A and or B, be in the service area, and they determine whether you live in the service area by your Social Security address. That's your Medicare address. So the address that you have filed with Social Security is your address. There's a late enrollment period. Unlike Part B, which is 10% of the base premium for every 12 months that you don't participate, that you delay. For Part D, it's 1% per month that you don't enroll when you're first eligible. And the 1% is not on the premium that you pay, the $7.35, but it's the percentage is based on the base premium, which is $33.06. Now, there's no premium penalty if you've had credible coverage prior to enrolling in Part D. FEHB plans all provide credible drug coverage, so you should never face a Part D penalty if you had your FEHB plan up to the point that you enroll in a Part D plan. So that kind of wraps up the 4 parts of Medicare. I just want to mention another piece of the puzzle, which is Medigap. Recall that I said earlier that Medicare was never intended to pay 100% of medical expenses. Medigap is there to fill that gap in what Medicare pays. And while the plans will differ in their generosity, they generally will cover your co-pays, co-insurance, and Part A deductible. Some will even cover that 115% excess charge. So a little bit about Medigap plans. They're private insurance for individuals. They're sold by private insurance companies. They supplement original Medicare, and they follow state and federal rules to protect you. When you sign up for a Medigap plan, in the first 6 months after you become newly eligible for Medicare, you get a guaranteed issue period, which means that there's no medical underwriting. They can't ask you your medical history or your health habits. You're guaranteed to be accepted. If you delay beyond the 6-month guarantee period, then you could be subject to medical underwriting. They can ask you your health history, whether you have any chronic illnesses, etc. And they can determine your premium based on your health history. So if you're going to sign up for a Medigap plan, it's best to do it within the first 6 months. They can also refuse to sell you a plan, depending upon your health history. With Medigap, you pay a monthly premium to the plan. The costs vary by plan and location. Medigap insurance companies can only sell a standardized Medigap policy. When you get your copy of Medicare and You from CMS or from VICAP, if you ask us for one, or if you look on the internet and download the publication called Medicare and You, on page 72, there's a chart that lays out the 10 standardized plans that Medicare Gap programs can offer. Okay, once you pick one of these standardized plans based on the level of benefits and you look at the different plans that are offering them, the only thing that will differ is the premium. They all offer the same package of benefits. It's just a different premium. And it may be that the premium is set using a different rating system. So it's really important to look carefully at these things and determine what you have. So at this point, I've sort of wrapped up Medicare and related programs. And I think we're going to take a little pause here to see if there were any questions about what I've been talking about. So I'm going to turn it back to Michelle, I believe.
Yes, thank you, Don. You have a phenomenal job so far. And before we transition to the federal retirement portion of the presentation, Patty is going to share a link to VICAP's survey to answer questions specifically related to Medicare. And I am going to read one of the questions that has not yet been answered in the chat that relates to federal retirees. So it says, if you are a federal retiree who retained Blue Cross and Blue Shield coverage, should you be enrolled in Part B, Don?
Well, that's the correct of the central point of the next part of the presentation. So if I could hold off on that, that question of to be or not to be is really central to the presentation.
Wonderful, thank you. If you have to, if the person who asked the question has to leave, and maybe that's why you asked it early, please do connect with us on the back end. You can either give us a call at 703-228-1725 or email medicarehelp@arlingtonva.us, and we'd be more than happy to answer that question. So the question could have been asked early because the person has to depart. If that's the case, please do connect with us on the back end, but we will dive into, in a few minutes, the meat and potatoes, I'd like to call it, for the retiree portion of the presentation. So I'm really excited. Thank you so much. You are doing such a phenomenal job. So proud of you. And we will give you all a few minutes to click on the link to the survey that our colleague Patty has shared. Please do respond to those questions, again, specifically relating to Medicare. And then after a couple of minutes, we will dive into the latter part of the presentation to specifically talk about to be or not to be. Thank you, Patty. Okay, Don, let's take it away and drive it home. We're going to transition to the last portion of the presentation. Thank you all so much.
All right, well, thank you, folks, for hanging in there for the Medicare portion of this. Now we get to what are your options? So now that we know the parts of Medicare, what they cover, what they cost, we can start to look at the options you face as a federal employee retiree. So the options really revolve around maintaining your FEHB and doing one of the following. Do not enroll in Medicare. That's the first option. There's no requirement for a federal employee or retiree to enroll in Medicare. You can completely skip it. Option 2, you can enroll in Medicare Part A only. Option 3, enroll in A and B. Option 4, enroll in Medicare Part A and or B and add a D. Option 5 is suspend, highlighted, bolded, your FEHB plan and enroll in a Medicare Advantage plan. Option 6 is a relatively new option. Maintain your FEHB with Medicare Parts A and B and enroll in an FEHB Medicare Advantage plan. I have below the options something else, which I don't think is really a very good option for anybody, and that is to cancel your FEHB and enroll in Medicare Parts A, B, and D and add a Medigap plan. I think it's really important to note that once you retire, canceling your FEHB is not a good idea, because once a retiree cancels and opts out, they can never return. So it's an important benefit that you've worked to keep, and it would not be wise to lose it. Okay, so what's a person to do? I mean, there's just so many different things that you can do. So let's look at this a little bit differently. So let's look at Medicare options for those 65 and over who maintain their FEHB. Okay, we'll look at Medicare Part A, B, C, and D in the chart. Look at active employees, retirees, and military retired TRICARE for life. Okay, so let's talk a little bit about active employees first. Okay, unless you do not have 10 years or 40 quarters paying Medicare FICA taxes, there's no reason for the active employee not to sign up for Part A when they're first eligible using that initial enrollment period. Okay. And while signing up for Part A will not reduce your FEHB premium, it supposedly helps to hold down the cost for everybody, so everybody's premium stays a little bit lower because Part A plays some role, sorry. If you don't have those 10 years or 40 quarters of paying your FICA taxes, you should keep working until you do, and do not enroll in Part A. The Part A premium could be as much as $471 per month, and there's little advantage to an active employee who doesn't have the 10 years that they need for premium free. But if you have premium free Part A, sign up for it. Turning to Part B, there's really little advantage for an active employee to enroll in Part B. Your FEHB plan is the primary payer and Medicare is the secondary payer. What that means is that Medicare will only be paying the deductibles and copays that are not paid by your FEHB plan. It's really hard to imagine, at least for me, that the secondary payments of these copays and deductibles would warrant the $148.50 Part B premium. But your situation may differ and you may want to consider it. But it's really hard to think about that 148 or higher if you're a higher paid federal employee to cover those copays and deductibles. Since you don't enroll in Part B, you can enroll in Part C because it's not available to you. But there are managed care plans, which are very similar to Medicare Advantage plans that are available within FEHB, such as Kaiser Permanente and Care First Blue Cross. And finally, if you maintain your FEHB, Part D, the prescription drug plan, is not necessary because prescription drugs are already built in to your FEHB program. So for an active employee who's turning 65, sign up for Part A if it's free, and delay enrollment in B until you need to decide during your special enrollment period after you leave federal service. Okay, now on to the retirees. Part A is free. There's no reason not to sign up for it if you have sufficient quarters for work. As with the active employee, if you don't have the sufficient quarters of work and you can't keep working because you're retiring, you may want to consider not enrolling in Part A because of the high premium. Okay? Nothing says you have to enroll in Medicare. Okay, so you could skip it if you have to face that $471 a month premium, and just stay with your FEHB just as you were when you were employed. Let's skip Part B for a minute and just look at, go down to Part D. Okay, if you maintain your FEHB in retirement, Part D, the prescription drug plans, is probably not necessary because prescription drugs are already built into the FEHB program. There is an exception though. There may come a time down the road, 20 years from now, you're kind of trucking along and the doctor prescribes for you some fancy new drugs that aren't part of the formulary of your FEHB program. At that point, you can look at a Part D plan. You could go to medicare.gov/plan compare, enter that new drug that you'd be having that you would have to pay a lot of out of pocket, and see if there's a Part D plan that might provide decent coverage for that medication. There's no penalty because you've had credible coverage up to that point, even if it's 20 years later. So while it's not likely that you need Part D, there's still the chance that you might be interested in it, so that window is always open to you as a federal retiree with FEHB. Okay, so now let's move on to the question that drives many Feds distress: to be or not to be. This is where many Feds raise the question. For the past 30 years, I've had my Blue Cross Blue Shield standard plan. I've had my FEHB Kaiser plan. I've had whatever in my FEHB. Why do I need another insurance? So let's look at some reasons why you might want to include Part B in your insurance bundle. I think first and foremost, in my opinion, is peace of mind, especially if you or your family have a history of illnesses. So if you go back 2 generations and people have had certain types of cancer for the last 2 or 3 generations, or they've had diabetes or other chronic conditions, you may want to consider B to help fill in some of the gaps. Okay, peace of mind. Okay, enrolling in Part B reduces your financial risk. All right, you pay your $148.50 a month, and between FEHB and Medicare Part A and Part B, you'll have almost complete coverage for all your medical expenses. So you have a known layout every month, and there's no surprises. So you'll have almost complete coverage. Part B may provide more coverage for certain products and services, such as durable medical equipment, than your FEHB plan will provide. You can use your Part B plan to go to a Medicare-approved service providers outside of your FEHB network, whether it's an HMO and a PPO, and just pay the 20% coinsurance. So you use your Part B rather than your FEHB to go outside. So if you wanted to go to the Mayo Clinic or some specialized health provider who accepts Medicare, but is out of your plan's network, go and just pay the 20% out of pocket. Okay. Even better, you can choose a possible Part D plan that offers what's called wraparound care, such as Blue Cross Blue Shield Standard. So what wraparound care says is that the plans will cover the 20% coinsurance if you use a Medicare provider outside of their network. So not all plans do this, and there's some confusion on the Blue Cross Blue Shield side. I will point out that Blue Cross Blue Shield Standard does provide wraparound care and will pay the coinsurance if you use a person outside the network. Blue Cross Blue Shield Basic, in some places I've seen, says it's offering wraparound care, but Basic will only pay if you use in-network providers. So you're not going outside the network. So I don't quite understand why some people might consider that wraparound. All right, so those are reasons, I think, to include Medicare Part B in your insurance bundle. What are reasons not to? Okay, so well, depending upon your choice of FEHB plan, the copays, coinsurance, and deductibles may not make the Part B premium worth it financially. If you have to pay the income-related subcharge on your Part B premium, if you're paying $297 a month or more, it definitely does not pay, at least while you're paying that higher premium. If you belong to an HMO, let's say you belong to Kaiser Permanente, and you're going to continue in that HMO in retirement, you may not need to enroll in a Part B plan. It may not pay because the deductibles and copays in your HMO are already so low. So it won't pay to pay that $148.50 or more. And the other thing to remember is if you don't enroll in Part B when you're first eligible, you can always enroll later and pay the 10% per 12-month premium delay penalty. I mentioned earlier that I don't think it's a good idea to drop your FAHB and go Medicare only. So let's just look at an example of what it might cost you to do that. So you pay your Part B premium, $148.50 or higher. You're subject to the $203 Part B premium deductible. Part B deductible, and you have to pay the $1,484 Part A deductible. You'd want to add a Part D plan. Let's say that costs $45 a month. There is no catastrophic limit in Medicare. So without a Medigap plan, you have no catastrophic limit. It means that you just keep paying your 20% and your deductibles throughout the year. So you might want to add a Medigap plan to cover the Part A deductible and most of the copays and co-insurance. Let's say that costs $150 a month at age 65 in 2021. And if you're 80 this year, you'd be paying $250. So those things add up. And before you know it, you're paying the premium of your FEHB plan, which might provide you with better coverage. The other thing to remember is that Medicare usually does not provide coverage out of the country, whereas most FEHB plans will cover at least some out-of-country medical care. So an alternative to dropping FEHB, enroll in A and B and change to a lower cost FEHB plan. Remember that the FEHB plan in retirement is the secondary payer. So it's paying the 20%, the co-insurance, 20% co-insurance, and some of the deductibles that you may have. Okay, I recently had a customer who was getting ready to retire. He was carrying a high option plan with a premium of $600 a month. If he enrolled in Part A and B at retirement, which he planned to do, there's no need to carry that expensive FEHB plan. And I advised him to look into switching to a less expensive plan. You could consider a high deductible plan with a health reimbursement account, which can be used to offset the Part B premium and other expenses. Plans such as the GIA high deductible health plan, Aetna high deductible best health plan, the National Association of Letter Carriers, consumer directed health plan. So these are plans that provide good benefits combined with A and B and a high deductible plan with a health reimbursement account. Now, a health reimbursement account is not a health savings account. You can't have a health savings account when you're in Medicare. But a health reimbursement account differs in that it doesn't belong to you, it belongs to the insurer. So when you leave that insurer, when you switch plans, any money left in the HRA goes away. Okay, so it's an important distinction that they make. You could consider an FEHB plan that provides a Part B subsidy, such as Blue Cross Blue Shield Basic, Aetna Direct, and GIA High. You could suspend your FEHB and enroll in a Medicare Advantage plan. And if you're interested in Medicare Advantage plans, take a hard look at the newer FEHB options for Medicare Advantage plans within that program. There are 3 right now that I'm aware of: Kaiser Senior Advantage, Aetna Medicare Advantage, and United Healthcare Retiree Advantage. A little bit more about these Advantage plans within FEHB. They have low premiums. They provide a Medicare Part B premium reduction. They have additional programs and they cover additional benefits. They provide gym memberships, home visits, meal delivery. They generally have zero deductible and coinsurance. They provide credible prescription drug coverage. There's seamless coordination of claims, use no claim forms. They have nationwide networks and coverage, and you don't need referrals to go from your primary care physician to see a specialist. Look at premiums and Part B reimbursements from FEHB plans for a moment. These are just a few that I pulled out. I'm not recommending any of these plans, but it's to give you an idea of what they offer and what the premiums are. Again, thinking about, go back to that slide about dropping your FEHB and what you would have to pay out of pocket for all the different pieces, including Medigap and Part D. So if you look at Blue Shield Basic, self-only is $170 a month, okay? And you get an $800 Part B subsidy. So it covers part of that Part B premium. If you're self plus one, it's $409.87, and you actually get $1,600 for the Part B premium for you and your spouse if you're both enrolled in Medicare Part B. GIA High Option, Aetna Direct, or other plans that offer a Part B subsidy, okay? The Aetna Advantage plan, which is $125 a month for self and $275 for self plus one, offers $900 for the self. United Healthcare Advantage, very low premium, and provides $600 for the individual. Kaiser Permanente, Senior Advantage, $150 a month, but they don't offer a subsidy for Part B, but it's something to consider. If you choose to suspend your FEHB to enroll in a Medicare Advantage plan outside of FEHB, you need to submit a form. There's a surprise. RI 79-9. It's found on the OPM website. And be sure when you're filling out this form to suspend that you read it carefully, and on the current version, only check box C on page 2. Page 1, the box is referred to canceling your insurance. Once that canceled insurance is processed, it's gone forever, so you don't want to make that mistake. Read carefully, check the right box. Okay, so a little bit about how Medicare and Parts A and B and FEHB work together. In retirement, Medicare is the primary payer. That means it pays first. Your FEHB plan works kind of like a Medigap plan. It's a secondary payer, and it pays what Medicare does not pay for Medicare-approved services. Your FEHB plan may pay the deductibles, copays, and coinsurance that Medicare does not. If the service is not Medicare approved, then your FEHB plan may step in as the primary payer, but it's not likely, and you need to carefully review the plan. If your Medicare provider is out of the FEHB network, a plan that offers wraparound will cover those additional charges of coinsurance and copays. Oops, sorry. So some things to be aware of. If you enroll in B, watch for the IRMA letter and be prepared to appeal if you meet any of the criteria. Remember, at retirement, you lose premium conversion, which allowed you to pay your premiums with pre-tax dollars. So while your premium will not go up, your out-of-pocket for that premium will, because now you're paying with post-op. You're not getting that tax advantage. At retirement, you will no longer have access to your flexible spending account, so make sure you spend it all before you retire. Once you're enrolled in Medicare, you will no longer be able to contribute to an HSA, though some plans will offer the health fund or the health reimbursement account. Retiring postal workers will lose the service's FEHB premium subsidy, so they will see a bump in their premium. And I think the last thing I want you to be aware of is that if you have a younger spouse, and/or minor dependents that are on your FEHB plan, you need to consider your options very carefully. The last thing I want to point out is to be aware of private contracts. A lot of doctors are now going into practices and requiring people to sign private contracts. This is an agreement between you and your doctor. Original Medicare and Medigap will not pay if there's a private contract in place. Other Medicare plans will not pay. You pay the full amount for those services you get. No claim should be submitted. FEHB, if you have that with your Medicare, won't pay because they only pay after Medicare pays. So be very aware of these private contracts. So some takeaways and a checklist. So enroll at the right time. Permanent financial penalties may apply if you don't. Research your options. Understand the differences between original Medicare and enroll in a private MA plan. Consider programs that reduce your out-of-pocket medical expenses. Understand the right to change your coverage. And you can always call VICAP or reach out to us through our email if you have any questions. I want to point out some documents and resources as I close. Okay, the Medicare Plan Finder I've mentioned several times. It's an excellent tool. It's been improved over the years, and it really provides useful information if you're looking at particularly Medicare Advantage plans and Part D plans. Okay, read your plan document, especially Section 9. Okay, the Blue Cross Blue Shield plan document is about 175 pages long, but you can skip to Section 9 and it will talk about how Medicare and your plan will work together. Plans also provide a guide called Medicare and You Guide for Federal Employees. Blue Cross Blue Shield has this, as do others, and it's an excellent guide to tell you how these two things will work together and provide coverage for your medical needs. Medicare and You Handbook is a publication from CMS. You would receive this with your Welcome to Medicare, but it's also available from VICAP, and it's also available from Medicare.gov website. If you click on publications, you can order a copy. An excellent guide for federal retirees and employees. If you haven't used this, you should really take a look at it. It's Washington Checkbook Guide to Federal Health Plans. It's primarily authored by Walt Francis, who worked at the Department of Health and Human Services and the Planning Evaluation Office for Health Policy for many, many years. It's actually, you'll notice that this is a 7-day loan. It's actually available from your local library, so you really don't even have to pay for it. If you're still working, your agency may have paid for a subscription, and you can take a look at that document. But it's really an excellent document. It goes through all the plans that are available, all the pluses and minuses about enrolling in Medicare or not enrolling in Medicare, etc. I mentioned preventative services a while ago. There is a guide to preventative services published by CMS. Again, it's available on the Medicare.gov website. Excellent resource. Other resources, of course, VICAP. Reach out to us, 703-228-17. Medicare Help at arlingtonva.us. So I want to thank you for joining us. I hope that you found this helpful. Remember that we're here for you. We're free, and we're happy to talk to you more if you have any specific questions related to your individual circumstances. You can contact us again at 703-228-1725 or email us at medicarehelp@arlingtonva.us. I'm going to turn it back to, let's see, Michelle, are you there?
Yes. Hi. Thank you so much, Don. Phenomenal job today. And thank you so much, Patty, for helping to manage the Q&A. I want to give our team a round of applause. They have done such a phenomenal job. Again, I'm so real proud of you all. Thank you so much for this collaboration and ensuring a successful event. We do have one other question that has come into the Q&A, or actually two at this point. The first question is, what is the benefit of joining interest-free Part A if I have federal health retirement benefits?
John, did you want to answer?
I'm sorry, Michelle, could you repeat the question?
Sure. Let me scroll back up. What is the benefit of joining interest-free Part A if I have FEHB?
Well, I think Don did a great job in that one table explaining when you should think about joining Part A or not. I mean, it's always been my experience through client interactions that you know, taking Part A usually is a smart choice. What's dangerous about absolutely rejecting Part A, and just be careful about that, is that you can untangle your entire Social Security claim. So I would think of it that way. You know, I would go back to that one slide, Don, that you had with the table in terms of when you should take all the components and kind of make your decision from there. But I mean, there's not, I think one of the takeaways from this whole session is that it's a dynamic decision, right? You have to look at your situation. So it depends on you working or not working. But usually most people consider A because if you've worked your 10 years, as Don mentioned, and 40 quarters, it is premium free. So think of it that way.
Can you hear me? Can people hear me?
Can.
Okay.
Yeah.
So the other thing that I'd like to point out is that if you belong to an FEHB plan with narrow network, that is, narrow hospital network, and you go out of that network, Medicare Part A will step in to cover that in-hospital care, which is really important. Okay, so you really need to be looking at your FEHB plan and your Part A plan when you make that decision. But it's, as we keep saying, it's free, so there's no reason to not sign up for it. And it does have some advantages. I hope that's helpful.
Excellent point, Don.
Thank you. The second question that's come into the chat or the Q&A area is, what if the individual has an HSA?
Oh.
That's a tough one.
Yeah. So my recollection on HSAs is once you sign up for Medicare, you can no longer make contributions to your HSA. I believe you can still use the money that's in your HSA until it's gone, but you can no longer make any contributions.
Right. I mean, that is my understanding also, that it's meant, once you have health insurance, you're meant to sort of not make contributions. I mean, I would say that's more of a tax question. But if you have a tax advisor, I would talk to them about it, but it is a complicated question.
I am transitioning to the next question, and I'm so sorry. I did see a note in here about the sound, and so I was just made aware that there could have been 2 times approximately that individuals were not able to hear us. I understand that it was intermittent, and so hopefully you all received the gist of the presentation. But wherever the sound lapsed, we're always happy to revisit and answer your questions again. So we apologize. Thank you for being flexible as we're all navigating through this digital and virtual landscape, especially these days. I will transition to the next question that we have, and again, just want to remind you all, especially if you are an Arlington County resident, you can contact the Arlington County VICAP program by calling 703-228-1725 or emailing medicarehelp@arlingtonva.us. And I think we'll have enough time for maybe another question or two. But the following question is, if I retired from the federal government and kept my FEHB plan because I traveled a great deal doing consulting work, if I now sign up for Medicare Part B, would I expect to have a penalty be, I think she's saying, is she going to expect to receive a penalty for Part B coverage? And if she has significant income and the cost could be as high as $475 a month, which is less than her FEHB premium, what would be the benefits of now moving to Medicare? And Don, would this be a one-on-one counseling question, or what would you recommend for this?
Yeah, I would recommend that this person reach out to us and we can deal with this more on a personal level. I mean, as I said in the presentation, if you don't sign up for Medicare Part B during your special enrollment period, which is the 8 months after you've left federal service, you will face the 10% penalty for each 12-month period that you don't sign up. So if you've been out of federal service for 5 years, let's say, that would be a 50% bump in your premium. And the 50%, by the way, is applied to the base premium. It's not applied to the IRMA premium, that subsidy premium. So it's the $148.50 would be 50% higher, and then on top of that would be your IRMA premium.
Right. Yeah, I mean, right. I mean, that's kind of what I was thinking too, Don. The way to think about it with one of the penalties with B, two things must be true for you to get the penalty, for you to avoid the penalty. That is, you have to be actively working and you have to have employer group health coverage. So if both of those things are true, you're working and you have employer group health coverage, and then later you join, past age 65, you join Medicare, you fill out the L564 and you get the penalty waive, because the government's like, great, you're working still and fine, continue to work. But since that client, that question, it sounds like that person could not prove that they were actively working. They do have employer group health coverage in retirement, but they can't prove they're actively working. So that's when the penalty will kick in. And to Don's point, if you do some back of the envelope math, that adds up quickly. So that's what's, Don did a great job. It is kind of a one-way street. Once you make that decision to take A or B, it is, it is somewhat of a permanent decision, because if you go back, you'll get stuck with the penalty, and that will probably not be so interesting to you. So.
Okay, thank you. And then we'll take one more. It says, what happens to your FEHB coverage if you enroll in a Medicare Advantage plan? Do you lose FEHB?
Okay. So I addressed this in one of the slides. If you want to go to a Medicare Advantage plan outside of the FEHB program, then you would suspend your FEHB medical insurance. The key word here is suspend, and you would fill out that OPM website web form, and you would submit it and suspend FEHB, and you could enroll in the Medicare Advantage plan. Okay. You don't want to cancel your FEHB, because if you decide a year from now that Medicare Advantage plan is not for you, and you want to go back to FEHB, you can. When you suspend, you can go back, and you'll be right back where you were with the same premium as everybody else pays. So it's really important to suspend that coverage and join that outside MA plan so that you can come back when you want to.
Hey Don, I have a question for you. That's a really good point, and I learned something there. I did not know the suspend option. Is there a time Is that like on a clock, or how does this
There's
suspend?
no clock. You can do that at any time.
Okay,
So
Thank
if
you.
you're, 10 years out and you decide you want to go to an MA plan for whatever reason, you can suspend. And then there's no clock for how long you can suspend to come back.
Excellent. Good. Thank you.
Yeah. Mhm.
Okay, thank you so much, team. You've done a phenomenal job. I'm going to provide one more question, and then I will pull the questions together that have not been answered, and then we can answer them collectively and then send them out to the attendees along with some additional resources. So please know that more information will be forthcoming. But the final question I'd like to pose from the Q&A is, do I need C and D if I have Federal, Blue Cross, Blue Shield as a retiree?
Could you repeat the parts again? Was it
C and D
C
if
and
I
D?
have Federal, Blue Cross, Blue Shield as a retiree?
Okay. So if you have Federal Blue Cross and Blue Shield as a retiree, and let's assume that you've signed up for Medicare A and B, you do not need C and you do not need D. As I mentioned, your FEHB, Blue Cross Blue Shield, provides credible drug coverage, probably at least as good, if not better, than most Part D plans. So you don't need one. So you don't need C and you don't need D.
Yeah. And thank you, Don. I will, to your point, Don, that, I've been a counselor with the VICAP program for 11 years, and it is interesting because sometimes feds will come to me and like, let's run the Medicare plan finder, your D, to see if the D plan will be better. And I can tell you 11 years later, I don't think I've found one.
Right.
So it's always worth the effort to assume maybe that one client that does find a D plan that's better for you, depending on the needs.
Right.
But 9.5 times, 9.8 times out of 10,
Right.
the federal plans with the prescription side usually are fairly robust, and folks usually stick with that.
Yeah, I mean, as I mentioned in the presentation, that because they have credible coverage for drugs under the FEHB plan, anytime between now and the future, they can apply for a Part D plan. If there are medications that aren't covered adequately under their FEHB plan, they can pick up a Part D plan to cover those drugs, and the two plans will work together. So, yeah.
Thank you. That was phenomenal. So thank you again, team, and thank you to all who have joined us and continue to hang on as attendees. We appreciate your connection with us. We appreciate the collaboration, and again, we're so happy to see that we've had attendees not only in Arlington County, but across jurisdictions and also out of state. So we're going to wind down this presentation. Appreciate you joining us again today. I'll work with our team, our strong VICAP team, and we will respond to the questions that we did not have a chance to respond to in the chat. If you are an Arlington resident and would like to receive Medicare counseling, please do contact us again by calling 703-228-1725 or by emailing medicarehelp@arlingtonva.us. If you're outside of Arlington County and want to get connected to another VICAP program within the state of Virginia, or if you're outside of the state and want to get connected to a state health insurance program in your locality, you can feel free to reach out to us as well, and we'd be more than happy to point you in the right direction. But again, thank you all so much for joining us today. It's been a pleasure. Please stay tuned to the VICAP website, www.arlingtonva.us, and in the search box, you can type in either Area Agency on Aging or VICAP, and our page will populate. But we look forward to reconnecting soon, and we hope that you all have a great day and a wonderful rest of your week. Take good care.
Thank you all.